Alright guys, this is always a tough video for me to get just because you have to see my feet. But here are my two favorite devices when I'm looking at improving either calf mobility, ankle mobility, reducing calf pain. So this is actually just a little wedge. It's a tire shock. I'll post a link in the video comments below on where you can get these on Amazon. And then this is just a half foam roll. It could be a full length, it could be a partial length, 12 inches, 30 inches, whatever is out there. Both of them work incredibly effectively. So let me show you what I would do at home. If this is my kitchen sink, I'm going to have either the wedge down here right up against the cabinet. And so maybe it's a bathroom sink. Every morning when I'm going to brush my teeth, I come in here, I set up so that my toe is at the top of the wedge and my heel is on the floor. The whole idea for me is I always want that heel touching the floor. And the reason why, and you can understand this, is because if you're trying to stretch a muscle, right, what do we want ultimately? We want that muscle to be relaxed. If I've got my heel suspended off the back edge of a step, that heel is in midair. There's no support under it. I'm never going to allow my nervous system to relax the muscle because the muscle is going to feel like it's going to want to rip. But if I can touch the ground, if I could touch something that gives me support under the heel while the rest of the foot is elevated, I'm going to allow my body to find the position where the tissue is on stretch, but it's not in a protective, guarded response, right? So that's what we're looking for. So these wedges are perfect for that. I would come in, toe at the top, heel on the floor. I'd bring my body right up against the sink right here. Maybe I'm doing dishes, maybe I'm brushing my teeth, whatever it is that I'm doing. I want to sustain this stretch. I personally prefer a 60-second stretch when I'm looking to relax the tissue and increase motion. Most people, most clinical research will show you that less than 10 seconds, there's no benefit. We know that as soon as we get into the stretch position, the first response is what we call a stretch reflex, where the muscle wants to tighten. But then after about 10 seconds, that response dissipates and now the muscle can relax a little bit. And then of course, what I do for the surgical side, I always do for the non-surgical side. And what I like about this as well is depending on the size of your foot. So I wear a size 9 shoe. My toe can touch the cabinet, my heel can touch the floor. And if I can stand nice and straight, I know I have full range of motion. This gives me some sort of objective measure. If I'm here because my calf muscle is too tight, behind the knee is too tight, I know that I need to work on this a little bit more, but we're looking for kind of normal ranges. I'm going to get rid of that. Let's pretend I don't have one of those wedges and I just have a little half foam roll. I do exactly the same thing. I set that underneath the cabinet. I put my toe against the cabinet, my heel on the floor. I come into position. I get the same stretch. It feels amazing. And then when I'm done, 60 seconds on one side, I come over, I hit 60 seconds on the other side. 2 to 3 episodes at a time. And then I would encourage you, if you're really dealing with some problem at the calf or the ankle mobility, this would be something every 2 to 3 hours throughout the day for about a week. You want to just continue to expose that tissue to this position. Our bodies are amazingly adaptive. So this is my #1 stretch for any kind of ankle limitation or if you want to stretch the calf muscle. Now let's talk about strengthening. So I said in the video, strengthening is a huge component of reducing the impact with every step you take. So I always ask my patients who have had a total knee replacement, let's begin with very simple heel raises at the kitchen sink. The kitchen sink is strong, it's stable, it gives me something to hold on to. I try to encourage them to do what we call a double limb heel raise. Then I would ask them to progress to a single limb heel raise. Because when you're walking, you're in that stepping stride position. You're going to have to be able to do that on a single limb. So If you're not strong enough to do a single limb heel raise, the nice thing about the kitchen sink is you can use this to help offload some of the weight. I can come on my forearms and my elbows, depending on the strength of your upper body, depending on the body weight, you can take off 50%, 90% of the load on the calf muscle. So you can really kind of control how much resistance is on there. Now, if you need to do what we call eccentric heel raise or heel lowering, there's a couple ways to do it. So number one, let's pretend that it's my left leg that had surgery or is particularly weak, and I want to do eccentric loading on my left. What I would do, I would pick that foot up, I'd get on my heel, I'd get on my toe. My right heel is what comes up, my left heel is what comes down. And then I switch, right heel up, left heel down. I would do 2 to 3 sets of 12 to 15 repetitions just like this. The whole idea is that we're doing kind of a slow, controlled loading motion on the injured side or on the involved side. Now you're saying, well, you're just going flat. What about the getting full range of motion? And that's where our foam roller would come in again, where I'd use my non-surgical leg or my non-injured leg to bring me up. I'd load onto the left, and then I would control the descent. My right brings me up, my left controls the descent back down. That is called eccentric loading. It's very popular strategy for dealing with any kind of tendinopathy, tendinitis. But when you're dealing with pain through the calf and you feel that calf muscle is just not strong enough, it's not recovering quick enough, these are my absolute favorite strategies. Now in a separate video, I'll show you how to use some sort of rolling pin or basketball or something to massage the calf muscle. Guys, I'll catch you on the next video.